So I think anxiety is equally prevalent in caregivers as well as patients who have cancer. There's some psychological studies that say that anxiety and depression are actually higher in the caregivers as opposed to patients. And I think, in my experience, I think there are definitely times when that's true. I think one of the things that's a bit challenging about anxiety and that's different with caregivers and patients, and I think this would be actually true through all stages, is that the patient is really thinking about their own death and the implications of the death for their family. The family is thinking about that, but they're also thinking in more detail about what their lives will be like after the person dies. And that's something that you don't want to share with the person who's thinking about dying. You don't want to say, well, I'm really worried. And let me say, one of the big topics I didn't mention earlier is finances are a huge concern for a lot of people. And it's a pretty difficult topic to talk about, so people worry about what will happen financially after, this is a family member, what will happen financially after someone dies, how will I take care of the kids after someone dies, should I remarry? So there are a whole series of issues that are often difficult for people to talk about. You know, it's funny, I think in almost every topic there's overlap. So what will this mean in terms of family finances? What will this mean in terms of how are we going to manage work? How are we going to take care of each other? What's going to happen to the kids? I think there's actually that many of the topics are the same. Who's helping the caregivers? So much of that is driven by individual dynamics. So let me say, I think there are two, in cancer patients who are older, I'm going to say 60 and over, there is, I think, culturally a strong sense that you shouldn't ask for help, that you need to stoically deal with problems, and especially for women, that you should be giving and that you should give everything to the other person. So I think it is really, in general, hard for older people to ask for help. I think the younger generations of people are growing up realizing that it's okay to ask for help, it's okay to be vulnerable. And so you'll see much more that people who are caregivers, a lot of people will be attentive both to the fact that the caregiver needs help as well as the patient. So I think that's partly a generational difference. The reality, and then I think the other just important dynamic is the individual personality. So there are just people who are stoical and think it's hard to ask for help and don't ask for help, and this is irrespective of age. And there are other people who are the opposite end, and they're kind of whining and complaining and, everything should focus on me. And then you get most people who are somewhere in the middle. And so I think it's partly personality driven and partly generational. This is a very difficult thing which has befallen everyone in the family, and that no one's needs trump anyone else's needs, as I think, and realizing that your own needs are important also. And I think in terms of strategies for managing anxiety, it goes back to techniques that involve distraction, techniques that involve sort of facing something and talking out how you're going to deal with it. And then for the caregiver, working out, how am I able to talk to my partner about this? For example, I'm really worried that you might die. I think saying, is my partner, can I talk to them, or is that something that's actually going to frighten them? And I need to find other outlets for that.